Hi, all my fellow RTs. I am coming to you from the front lines in the middle of New York.
It's at Rush University Medical Center in Chicago, Illinois.
It's at Providence Medical Center up in Everett.
At Central Georgia Hospital.
At the UCSF Benioff Children's Hospitals in Oakland and San Francisco.
My name is Felix Husit. I'm an administrative director for respiratory therapy and pulmonary physiology center at New York Presbyterian Brooklyn Methodist Hospital. I'm also president of NIDART, New York Downstate Association for Respiratory Therapists.
The shifts here are often hectic, fast-paced. You barely have time to eat, much less drink and use the bathroom. Sorry, I thought you could see what I actually look like. Whew, this is what we wear. It's hard to process how horribly ill so many patients are. This virus is brutal and vicious and does not discriminate. These are the sickest patients I've ever seen. We have dentists, guys, dentists running our equipment. Running our blood gases, and their staff are cleaning our equipment. Thank God for them, because we don't have time to do it ourselves. We are often facing this virus without proper PPE. It's not the hospital's fault. They can't supply what simply doesn't exist. It adds to the stress, though, that we already feel having to hunt down protection at the beginning of the shift. No one was prepared for the amount of people that would need our care. On the upside, I've made some great new friends, my nurses and RTs. We are brave and strong, caring and compassionate. We hold our patients' hands and sing to them so they don't die alone. No one in my generation has ever had to face anything like this, but for what it's worth, we're doing the best we can. Stay safe, guys.
One of the things the respiratory therapists are doing here to fight COVID-19 is we're placing our patients in the prone position. Due to the volume of this procedure, we've developed a multidisciplinary team to go around the hospital and perform this procedure. The team is driven by a respiratory therapist, and it consists of a PT, an OT, and a registered nurse. For everyone that's out there fighting COVID-19, hang in there, we're in this together, and stay safe.
There were not a lot of resources available to us when we started caring for critical COVID patients, so we learned to manage these patients' specific needs on the fly and have had quite a few successful extubations and subsequent recoveries. One of the most important things that we have learned is if you notice that a patient is starting to decompensate, be prepared to go ahead with intubation very quickly. We have been using the glide scope and going directly from tube placement to ventilator without bagging to try to minimize the aerosolization of particles. Good luck.
This is our inlet. We hook this up to our high flow to our high flow setup. We can go up to 50 or 60 liters. And then this is our outlet. So we have a bacteria filter attached to a PEEP valve where we start at 5 a PEEP and we can go up to 10. We strap it down so that the helmet stays nice and tight around his shoulders.
As a therapist, think of how many times you've actually in your career had to wear an N95. Currently, it is an everyday, almost every patient occurrence. I can assure you that after a 12-hour shift, your face hurts, the bridge of your nose is sore, and that gasping for breath happens with us as well as the patients.
Hi, my name is Alexis. Before COVID, patients could recognize who you were. They could recognize a friendly respiratory face. Now, everybody looks the same. We're all behind masks and behind gowns, so nobody really knows who we are as their respiratory therapist.
Before COVID kind of invaded our little town, we got to wear our regular scrubs. I didn't have to worry as much about going home and giving my child anything that he didn't need to have. And now I'm having to change before I get home, when I get to work, and just trying to keep him protected from all of this. I think it's changed the way that we think about how we practice, using certain ventilators and using certain devices, and not in the most traditional way. One of the interesting things is, being a 30-year veteran, I've been able to teach my young team how to do things that we used to do in the past, which is relevant today, which yesterday it wasn't relevant. But because of the resources, we have to be very careful but it's been fun teaching them how to be resourceful and teaching them what we used to do back in the day, but it is still relevant today. We just have better equipment now than we did 25, 30 years ago.
We actually created 3 more ICU units in the hospital. We have our EICU that's still running, so those nurses and docs keep an extra eye on our patients from outside of the ICUs and can monitor patients from different facilities.
We have the Vizio telemetry to kind of monitor your patients with continuous heart monitors and pulse ox monitors, so you're just you're able to see that patient decline or progress and get better. So then we're able to either step up therapies or actually wean down therapies constantly, because we always have that extra technology.
It's been very overwhelming for us. We see 100% of the COVID patients. Our team of 26 or 30 today has seen almost 300 of our patients that are rule out or COVID positive, along with all the other patients in the hospital. It's been super overwhelming because we've gone up 200% on our ventilator utilization in the past 14 days, and but my team is so amazing, and they're so efficient, and I'm just so very proud of them because they work really, really hard to make sure that all of our patients are seen and their care is given appropriately.
Collaborative care in an ICU during a pandemic is vital. To ensure quality care is given to the patient, a plan needs to be made. Go Team RT.
Thanks, Ford, for the face shields.
Alright. Am I good?
You're good, Hank Smith. You're beautiful.
No, we have 3 standby. Alright.
So far, it would appear that California has flattened the curve. The shelter-in-place order appears to be working, and right now, although we do have COVID patients in the adult hospitals, our pediatric hospitals are pretty quiet. We've actually opened up beds, we have capacity, and our surge level right now is a green. It appears that kids are less affected, but it doesn't mean we should let down our guard. We need to tell our colleagues, continue to shelter in place, and we'll see what the next couple weeks brings. Thanks so much for all you do, and stay safe.
I would like to thank all the respiratory therapists everywhere that heroically work to save as many patients as possible, countless hours in very, very difficult conditions. I also would like to acknowledge all other healthcare professionals that came together as a family, as a real family, to try to save patients. I would like to acknowledge nursing staff, physicians, biomedical technologists, laboratory technologists, radiology, and procurement staff that was instrumental in helping us to get the necessary equipment to treat our patients. A lot of people truly came through trying to save as many patients as possible, and a lot of times risked their lives trying to help patients. And some of them paid with their lives to provide for others. Thank you and God bless.